Section 4B, Overview of EQA Program Implementation and Alignment to ISO15189:2022. Learning Objectives. Following completion of this session, participants will be able to understand the evaluation aspects of ISO15189:2022 in relation to the QMS requirements, discuss the importance of an EQA program in improving the quality of laboratory test results, describe at least 3 EQA methods and the advantages and disadvantages of each, outline a method to investigate an unacceptable test result from an EQA sample. Evaluation aspects of ISO15189:2022 QMS. Management and technical requirements of ISO15189. Management requirements. For Point 1, Organization and Management Responsibility, 4.2 Quality Management System, 4.3 Document Control, 4.4 Service Agreements, 4.5 Examination by Referral Laboratories, 4.6 External Services and Supplies, 4.7 Advisory Services, 4.8 Resolution of Complaints, 4.9 Identification and Control of Nonconformities, 4.10 Corrective Action, 4.11 Preventive Action, 4.12 Continual Improvement, 4.13 Control of Records, 4.14 Evaluation and Audits, 4.15 Management Review. Technical requirements. 5.1 Personnel, 5.2 Accommodation and Environmental Conditions, 5.3 Laboratory Equipment, Reagents and Consumables, 5.4 Pre-examination Procedures, 5.5 Examination Process, 5.6 Ensuring Quality of Examination Procedures, 5.7 Post-examination Processes, 5.8 Reporting of Results, 5.9 Release of Results, 5.10 Laboratory Information Management. 4. Support processes, customers, schematic representation of process, approach, inputs, outputs, top management processes, planning, allocation of resources, management review, etc., realization processes, customer-related processes, design and development, product realization, etc., support processes, training, maintenance, etc. Customers' top management process realization processes, ABC5. Model of Process-Based Quality Management System, QSTOMER. REQUIREMENTS. Continual Improvement of the Quality Management System. Resource Management. Improvement. Analysis. Measurement. Measurement. Analysis and improvement. Man. Organization and management responsibility. For Point 1, Impartiality, 4.2 Confidentiality, 4.3 Requirements regarding patients, 5 Structural and Governance requirements. Resource Management. Quality Management System. 8.2 Management System Documentation, 8.3 Control of Management System Documents, 8.4 Control of Records. 6.2 Personnel, 6.3 Facilities and Environmental Conditions, 6.4 Equipment, 6.5 Equipment Calibration and Metrological Traceability, 6.6 Reagents and Consumables, 6.7 Service Agreements. 6.8 Externally Provided Products and Services. Evaluation and Continual Improvement. 7.5 Non-conforming work, 7.7 Complaints, 7.8 Continuity and Emergency Preparedness Planning, 8.6 Improvements, 8.7 Nonconformities and Corrective Actions, 8.8 Evaluations, 8.9 Management Reviews. User. Request. Processes requirements. 7.2 Pre-examination processes, 7.3 Examination processes, 7.4 Post-examination process, 7.6 Control of data and information management. User. Report. Requirements. Satisfaction/dissatisfaction. Evaluation activities. 4.8 Resolution of complaints. 4.9 Identification and Control of NCs. 4.14 Evaluation and Audits. 4.14 Evaluation and Audits. 5.6 assuring the quality of examination, EQA, and periodic review of request and samples assessment of user satisfaction staff suggestions quality indicators review by external organizations, and improvement activities. For point 10 corrective action, remedial action, reviewing NCs, determining the root cause of the NCs, determining and implementing corrective action taken, recording of the result of CA. 4.11 preventive action, reviewing laboratory data and information to determine potential sources of nonconformances, determining the root causes of potential NCs, reviewing the effectiveness of the CA taken, evaluating the need for preventive action to ensure NCs do not occur, determining and implementing PA taken, recording of the results of PA. 4.12 continual improvement, reviewing the effectiveness of PA. For point 15 management reviews. For point 15 management reviews. For point 15 management reviews. Resolution of complaints. ISO15189 says, for point 8 resolution of complaints, the laboratory shall have a documented procedure for the management of complaints or other feedback received from clinicians, patients, laboratory staff, or other parties. Records shall be maintained of all complaints and their investigation and the action taken. See also 4.14.3. What is a complaint? An expression of dissatisfaction made to an organization related to its products, services, or the complaints handling process itself, where a response or a resolution is explicitly or implicitly expected. ISO 10002. Why do customers complain? Their expectations have not been met. Quality is fulfillment of expectations. Customers' needs when they complain. Needs as individuals, to be heard, to be understood, to be respected, needs relating to the complaint, to have their concern dealt with quickly, fairly and properly, to be given what they have been denied, and perhaps an apology to have action taken to fix a problem or address a concern, a resultant process change. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. Information concerning the complaints handling process, such as brochures, should be made readily available to customers, complainants, and other interested parties, and should contain the following: where complaints can be made, how complaints can be made, information to be provided by the complainant, the process for handling complaints, time periods associated with various stages in the process, how the complainant can obtain feedback on the status of the complaint. 15. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. Upon reporting of the initial complaint, the complaint should be recorded with supporting information and a unique identifier code. Other information to be recorded include the following: a description of the complaint, the requested remedy, the service being complained about, the due date for a response, immediate action taken, if any. 16. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. Receipt of each complaint should be acknowledged to the complainant immediately, for example, via phone, email. 17. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. After receipt, each complaint should be initially assessed in terms of criteria such as severity, safety implication, impact, and the need and possibility of immediate action. 18. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. A root cause analysis of the complaint should be done and a corrective action be implemented. 19. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. The decision or any action taken regarding the complaint, which is relevant to the complainant or to the personnel involved, should be communicated to them as soon as the decision or action is taken. 20. Close. Complaint handling process. Communicate how to complain. Receipt of complaint. Acknowledgement of receipt. Assessment of complaint. Corrective action. Communicate the decision. If the complainant accepts the proposed decision or action, then the decision or action should be carried out and recorded. If the complainant rejects the proposed decision or action, then the complaint should remain open. This should be recorded, and the complainant should be informed of alternative forms of internal and external recourse available. 21. Close. Identification and control of NCs. 4.9 Identification and control of nonconformities. The laboratory should have a documented procedure for handling nonconformances, and this should address the following: who is authorized and responsible for handling nonconformities? What is the immediate action to be defined? Extent of nonconformity is determined. Examinations are halted and reports with held medical significance on the NC is considered. Results of any NC results already released are recalled. The responsibility for authorization of resumption of test is defined. Damage control. 23. What is a nonconformance? A nonconformance means that something went wrong. A problem has occurred and needs to be addressed. It is a failure to comply with the requirements of the organization's quality management system, policies, procedures. Forms ISO15189 requirements, safety and good laboratory practices, technical requirements of specific technical areas of the system, e.g. failure to hold the micropipette correctly. Nonconformances. Nonconforming activities occur in many different areas and can be identified in many different ways, including clinician complaints, IQC failures, instrument calibrations, checking of consumable materials, EQA staff comments, management reviews, internal and external audits, results outside TT. External quality assurance / proficiency test. Important elements. What is PT? A program in which multiple samples are periodically sent out to members of a group of laboratories for analysis and/or identification, whereby each laboratory's results are compared with those of other laboratories in the group and/or with an assigned value and reported to the participating laboratory and others. Why participate in proficiency testing? To meet the requirements in line with international accreditation, improvement of comparability in testing and calibration. Proficiency testing can be used to consistency and comparability of data for individual testing / calibration personnel, evaluation of test results, demonstration of testing competence to customers and authorities, determination of the effectiveness of quality management measures. PT results follow normal distribution. Performance evaluation. Use of Z-scores or EST, this is a standardized score based on the mean and the standard deviation. One Z-score for each raw score. Purpose of the Z-score tells the exact location of the original value within the distribution. Z-scores will form a standardized distribution that can be directly compared to other distributions that have also been transformed into Z-scores. Z-score. How to evaluate your performance. The results of each PT round are to be specifically evaluated regardless of the performance obtained, as a satisfactory result may not necessarily mean a good performance. The laboratory should have the instructions from the PT provider which explain the performance criteria after receiving the PT performance report. Check for each individual parameter to see if you are within the acceptable limits. Check to see if the results you submitted are the actual ones on the PT report. Poor performance. Poor performance provides the laboratory with a golden opportunity to review their testing system and to conduct root cause analysis. The review process should review how the sample was received, kept before testing, tested as well as how the results were written and sent to the PT body. External quality assurance / proficiency test in practice and application. Scenario. A newly appointed quality officer has begun reviewing past EQA results and observes poor gram stain performance. External quality assessment, a system for objectively checking the laboratory's performance using an external agency or facility 36. EQA proficiency testing, rechecking, retesting, on-site evaluation, 37 types of external quality assessment. External quality assessment. Black small square comparison among different test sites, black small square early warning for systemic problems, black small square objective evidence of testing quality, black small square areas that need improvement, black small square training needs. EQA benefits. Laboratory oriented objectives. Public health oriented objectives. EQA confidential, free or charged recognition, education, regional, national, international, obligatory / voluntary. EQA important for improvement, a measure of laboratory performance. ISO / IEC proficiency testing schemes, PTS, are interlaboratory comparisons that are organized regularly to assess the performance of analytical laboratories and the competence of the analytical personnel. CLSI QMS 24. A program in which multiple samples are periodically sent to members of a group of laboratories for analysis and/or identification, whereby each laboratory's results are compared with those of other laboratories in the group and/or with an assigned value, and reported to the participating laboratories and others. PT process. PT organization / provider. Laboratory. PT samples sent regularly. Evaluation. Analyze. PT performance report. Return results. Receive PT report. Corrective actions. 44. Laboratory 1, Laboratory 2, no discussion between labs PT. Roles of laboratory final PT report received ISO15189, analyzed same manner with same personal improvement, PT sample, patient sample 45. Information received from PT participation must be directed toward improvement in the laboratory to receive the full value. PT results. 46. Black medium square PT results are affected by variables not related to patient samples. Black medium square PT will not detect all problems in the laboratory. Black medium square PT may not detect problems with pre- and post-examination procedures. Other EQA methods, rechecking / retesting. Peripheral laboratory. Reference laboratory. Rechecking. 48. Retesting. Tested by reference laboratory, performed on dried blood spots or serum, not blinded, statistically significant, primarily used to assess HIV rapid testing. Rechecking. Samples must be collected randomly. Avoid systematic sampling bias, statistically significant, resolve discrepancies, effective feedback, primarily AFB. Comparison of rechecking non-blinded and random blinded smears for acid-fast bacilli. Performance characteristics measured non-blinded sample, 1998. Random blinded sample, 2002. State A. Sensitivity 99.7%, 86.7%. State B. Sensitivity 98.9%, 84.7%. State A. Specificity 99.8%, 99.1%. State B. Specificity 99.9%, 99.7%. Martinez A. ETAL. Inc. J. Tubik. On-site evaluation. Black small square to obtain a realistic picture of laboratory. Practices. Black small square to provide assistance with problem areas. Periodic visits. External group or organizer. Laboratory. AFB microscopy, comparison of performance before and after on-site monitoring. No sand bucket 9627, no decontamination of sputum cup 6023, no disinfectant 314, no biohazard waste bin covered. For 88, no lab coats. 4846 technologists do not wash hands. 174 shortage of lab reagents. 7527 improper sputum collection. 6031 improper filling of laboratory register. 294 improper labeling slides / containers. 3113. Before %. After %. Proficiency testing and rechecking. Characteristics PTRC interlaboratory comparison. Yes, simulated samples. Yes, no real samples. Yes / no yes time and resources. Needed less more analytes. Evaluated many few. EQA participation. Recommended for all laboratories. ISO15189:2022 clause 5.6.3 requirement. ISO 15189. Management process. Handle and analyze EQA samples. Treat EQA samples same as patient. Monitor and maintain records. Investigate deficiencies. Manage corrective action efforts. Communicate outcomes. EQA results. Corrective actions. 56. Reviewing EQA feedback. Important statistics group mean obtained results standard deviation index histograms LJ charts, 4 subsequent cycles, box curves. SDI. Important statistics, SDI calculation. Rule of thumb for SDI. Important statistics, SDI interpretation. EQA performance problems challenge sample management examination report pre-examination post-examination PT provider 60. EQA should lead to actions. EQA. Identify. Problems. Take corrective action. 61. Summary. EQA is a system for objectively checking the laboratory's performance using an external agency or facility. All laboratories should participate in EQA. Several methods of EQA in use. EQA samples must be treated the same as patient samples. Key messages. EQA uses valuable resources. Make the best possible use of it. EQA should not be punitive. EQA should be viewed as educational. EQA can help direct improvement efforts. EQA is a critical element of a quality management system. Thank you.